This presentation is going to review Chapter 12 of the Patient Care book, Pharmacology for Radiographers. Chapter 12 moves us into the last unit of the textbook, Unit 3, which is Special Procedures. At the end of this presentation, students will be able to describe the symptoms and medical interventions for a patient having a reaction to contrast media, distinguish between the chemical, generic, and trade names for various drugs, explain the uses and impact on the patient of different categories of drugs, define the categories of contrast agents and give examples of each, describe the general pharmacologic principles of radiologic contrast media, and describe the pharmacokinetic, pharmacodynamic, and pharmacogenetic principles of drugs, identify and explain drug safety in the administration of contrast and other drugs, and describe methods and techniques for administering various types of contrast media. Pharmacology is the study of drug actions and interactions with living organisms. Drugs are chemicals that can affect the body in various ways, and while all drugs can be harmful if misused, they are intended to treat disease and alleviate suffering. Drugs, biologics, and alternative therapies are the main categories of substances used for treatment. A drug is a chemical that produces a biological effect, which can be either therapeutic or adverse. Once administered, it is known as a medication. Biologics are naturally produced agents such as hormones, vaccines, or blood products. Alternative therapies include plant extracts, herbs, vitamins, minerals, dietary supplements, and unconventional methods like acupuncture. Pharmacology requires both theoretical and clinical knowledge. Radiographers are not licensed to dispense drugs or access hospital pharmacies and are legally responsible for any drug-related errors. Any drug mistakes must be documented and reported according to the institution's policies. In the United States, strict federal standards control drug safety. Drugs labeled with caution federal law prohibits dispensing without prescription include those that must be administered parenterally, are hypnotic or narcotic, may cause dependence, contain habit-forming substances, may be toxic without supervision, or are new and investigational. Over-the-counter drugs, abbreviated OTC drugs, are deemed safe for self-administration and can sometimes be purchased in lower potencies than prescription versions. The FDA reviews these over-the-counter drugs for safety. Alternatively, dietary and herbal supplements classified as food rather than drugs are not regulated by the FDA. Their safety and efficacy are not required to be proven, and they are not considered part of standard medical care. Drugs can be derived from natural sources like animals, plants, microorganisms, and minerals, as well as synthetic materials created in laboratories. Some drugs are genetically engineered for specific treatments. Drugs have multiple names. Their proprietary or trade name, which is given by the manufacturer. The chemical name indicates the exact chemical formula and remains constant. The generic name is assigned before official approval, used universally to describe the drug. For example, diazepam is the generic name for the trade name drug Valium. Healthcare practitioners may struggle to keep up with all new drugs. It is essential to consult reliable sources such as the American Hospital Formulary Services, AHFS, Drug Information, and the Physician's Desk Reference to obtain accurate drug information. Radiographers should know where to find these references at work and use them as needed. Generally, drugs are sorted according to their characteristics, such as their therapeutic benefits or potential for abuse and addiction. Three main classification methods include the chemical structure of the drug, the specific cellular mechanism and organ targeted by the drug's effects, and the drug's intended therapeutic use. In pharmacology, these classifications are referred to as schedules. Drugs impact the central nervous system, influencing emotions and behavior. There are three primary types: depressants, stimulants, and hallucinogens. Depressants are substances that slow down the central nervous system, leading to feelings of relaxation and diminished inhibitions. They impair coordination and concentration, making responses to situations slower. Common examples include alcohol, opiates, and tranquilizers. Stimulants are drugs that accelerate the central nervous system, increasing heart rate, blood pressure, and body temperature. They can reduce appetite and cause insomnia. Examples of stimulants are caffeine, nicotine, and amphetamines. Hallucinogens are substances that alter perception of reality, which can lead to feelings of euphoria, panic, or paranoia. They may also cause gastrointestinal discomfort and nausea. Examples include ketamine and lysergic acid diethylamide, or LSD. While a drug cannot alter cellular structures, it influences the rate and extent of normal or abnormal physiological processes within the cells. The drug undergoes absorption, distribution, metabolism, and excretion. It reaches its intended effect at a specific point known as the onset of action. As absorption continues, the drug attains its peak concentration, during which it achieves its maximum therapeutic response and delivers its optimal curative or remedial effect. The period during which the drug remains in the body at a therapeutic level is referred to as the duration of action. Eventually, as the drug is eliminated, its concentration decreases and its intended effects diminish. Pharmacokinetics refers to how the body absorbs, distributes, metabolizes, and excretes drugs. These processes vary based on factors like age, diet, ethnicity, health status, and environmental conditions. For a drug to work, it must be absorbed into the bloodstream and reach its target site. Bioavailability refers to the proportion of a drug that reaches the bloodstream and is available for the body to use. When a drug is administered, it must be absorbed into the bloodstream to have an effect. The extent to which the drug is absorbed and reaches systemic circulation, rather than being lost or metabolized before reaching the blood, determines its bioavailability. Drugs cross cell membranes mainly through passive diffusion, moving from high to low concentration without energy. Active transport requires cellular energy to help move certain drugs and electrolytes against their concentration gradient. This method involves carrier molecules and sometimes pinocytosis. Pinocytosis is a type of cellular process where cells engulf extracellular fluids and dissolve substances to bring them into the cell. It is often referred to as cell drinking. Orally taken drugs are typically absorbed in the small intestine, where absorption can be hindered by damage or removal of intestinal sections. Blood flow to the absorption site also affects drug uptake. When taking a drug orally, it moves from the stomach to the small intestine, then to the liver, where part of it is broken down before reaching the bloodstream. The initial breakdown is called the first pass effect. To ensure enough of the drug remains effective, a higher dose may be necessary. Drugs administered under the tongue, vaginally, or through injections bypass this effect by entering the bloodstream directly, although these methods might not always be suitable. Additionally, some drugs, after being absorbed, are sent from the bloodstream to the liver and then through the bile ducts. This process is called enterohepatic recycling. This allows the drug to remain in the body for a longer period of time. Once a drug is absorbed into the bloodstream, it is transported to its target site within the body. The efficiency and extent of this distribution depends on factors such as adequate blood flow, protein binding, and the drug's tendency to associate with other lipid-rich or aqueous tissues. Drugs tend to reach organs with high blood supply, such as the heart, liver, and kidneys, more rapidly, while muscles and fatty tissues receive the drug more slowly. As the drug circulates, it may bind to plasma proteins or remain unbound. When a drug is bound to plasma proteins, it is rendered inactive, whereas only the unbound or free drug can exert its effects on cells. As the free drug interacts with the cells, the plasma levels decrease, allowing the bound drug to be released and become active. This process helps maintain relatively stable blood levels of the drug over time. Factors such as patient's health and the properties of the drug itself will influence how well the drug is distributed through the body. Metabolism, also called biotransformation. This typically decreases the drug's lipid solubility, preparing it for excretion. Most drug metabolism occurs in the liver. Some drugs are also metabolized in plasma, kidneys, lungs, and the intestinal mucosa. Factors such as age, health, time of day, emotional state, other medications, genetic differences, and diseases can affect metabolism rates. Changes in metabolism may lead to drug accumulation, causing an adverse reaction, an effect produced by a drug that is severe or life-threatening, or result in rapid metabolism that reduces the drug's effectiveness. Oral drugs are often significantly metabolized by the liver's first pass effect, impacting their overall metabolism. Drugs are mainly excreted by the kidneys, either unchanged or after metabolism. They can also be expelled through the biliary tract into the feces or via the enterohepatic cycle before being eliminated by the kidneys. Anesthesia gases and volatile liquids are excreted through the lungs, while sweat and saliva play a minor role. Half-life is the time required for a drug's concentration in the body to drop by 50%. Knowing this helps maintain steady drug levels by matching intake with elimination every 24 hours. Drugs with a short half-life need more frequent dosing than those with a longer half-life because they metabolize faster. The clearance rate is how quickly a drug is removed from the body. Drugs with slow clearance may accumulate and become toxic if given too often. Contrast media used in imaging are rapidly distributed and excreted by the kidneys within 24 hours, as they are not metabolized like other drugs. Pharmacodynamics examines how drugs interact with living tissues and how these interactions produce effects at various body sites. It focuses on how drugs influence physiological functions, including blood pressure, heart rate, urinary output, central peripheral nervous system functions, and other bodily systems. Drugs don't create new functions in tissues or organs, but modify existing physiological processes. Although a drug usually targets a primary site of action, it impacts all body tissue to some extent. The pharmacodynamic effect encompasses the overall impact of the drug once it reaches its target site. Pharmacogenomics, also known as pharmacogenetics, is the field of pharmacology that expresses how genetic factors influence drugs' responses. It examines how an individual's genetic makeup affects their reaction to medications, helping to determine the most suitable drug and dosage for each person. For example, certain antidepressants' effectiveness can be influenced by genes CYP2D6 and gene CYP2C19. Physicians may test for these genetic markers before prescribing certain types of medication to tailor the treatment to the patient's genetic profile. Contrast media enhances the visibility of specific body parts during imaging procedures. Radiographers need to understand their composition, pharmacokinetics, and potential reactions, as these substances can enter the bloodstream and cause allergic or physiological responses. Careful preparation is required for their use. Types of contrast used in radiography include negative contrast media, which makes organs appear darker or radiolucent by allowing more X-rays to pass through. Positive contrast media, which makes organs appear lighter or radiopaque by blocking X-rays. This includes barium and iodine-based media, and radionuclides, which are used in nuclear medicine for imaging by emitting radiation. When performing a double contrast study, such as with oral barium, air or carbon dioxide may be added to improve imaging. Carbon dioxide is preferred for lower GI studies due to its quick absorption and comfort. Negative contrast media characteristics include a low atomic weight, a decrease in organ density, absorbs fewer radiation photons, increases image density, it's radiolucent, and rapidly absorbed by the body. Positive contrast characteristics include having a high atomic weight, they increase organ density, they absorb more radiation, they decrease image density, they're radiopaque, which means they're going to show up bright on an image as shown on this digestive study on the slide. They're water soluble and are excreted via the liver or kidneys, and they're generally non-toxic. Positive contrast media are either insoluble, barium, or soluble, which is iodine-based. Barium must be kept mixed in water, while soluble media are hypertonic, affecting hydration and contrast quality. Barium is the most common contrast used for GI imaging. It does not dissolve and is suspended in solution. Its metallic properties make it ideal for this purpose. Gastrographin is another contrast medium used for GI studies. These type of contrast medias are ingested by the patient orally. Other positive contrast media, known as iodinated contrast media or ICMs, contain iodine. Iodine has an atomic number of 53. And barium with an atomic number of 56. They absorb X-ray photons, creating white areas on the image. Higher atomic numbers increase photon absorption, resulting in better image contrast or brightness. Iodine-based contrast medias are used to enhance the visibility of various body systems, including GI tract, kidneys, gallbladder, pancreas, heart, brain, uterus, spinal column, as well as vascular structures. They are essential for diagnostic imaging in CT and fluoroscopy. CT technologists frequently work with contrast media due to its prevalent use in CT scans. Iodinated contrast is typically injected into the bloodstream via an IV. Gadolinium-based contrast agents are used in MRI, and they have an atomic number of 64. They are radiodense and used for MRI studies. Gadolinium-based contrast media are generally considered safe for MRI with no nephrotoxicity at approved doses, meaning they will not put a patient into kidney failure if they're used appropriately. Overuse of contrast media IV is damaging to patients. The radiodensity of tissues can change significantly depending on the type of radiopaque contrast media used, which is influenced by the iodine content. Common iodinated contrast agents use either megalamine salts or sodium salts, or a combination of both. Megalamine salts are less toxic but more viscous than sodium salts. Positive contrast media consists of a cation, sodium or megalamine, and an anion, which mainly affects the contrast composition. A cation is an ion with a positive charge, meaning that it has lost one or more electrons. Conversely, an anion is an ion with a negative charge, meaning it has gained one or more electrons. In contrast media, the cation and anion combine to form compounds that help visualize structures in imaging. Ionic contrast media contain charged particles, or ions, that can cause higher osmotic effects and potential side effects. Non-ionic contrast media have no charged particles, resulting in lower osmotic effects and reduced risk of adverse reactions. Ionic and non-ionic contrast media have different chemical structures, but both do contain iodine. Early contrast media were iodinated benzoic acid salts with high osmolality, meaning they caused significant osmotic effects and higher risk of adverse reaction. These salts dissociated into ions into a soluble solution. contributing to their osmolality and toxicity. In newer contrast media, cations, which do not contain iodine, were replaced with hydroxyl groups to reduce osmolality and adverse effects. This shift led to the development of low osmolality contrast media, or LOCM, which are safer and closer in osmolality to human plasma, reducing the risk of complication. Research has improved on iodinated contrast media, making them safer for intravascular use, meaning injected into the bloodstream. Lower osmolality media, especially non-toxic types, are less likely to cause severe side effects compared to older ionic media, while still providing high-quality imaging. It doesn't completely eliminate the potential for adverse reactions, but it does minimize the severity of adverse reactions. Contrast media follow the same pharmacologic processes as other drugs: absorption, distribution, metabolism, and elimination. For effective imaging, the contrast must reach its target area. Barium is ingested or introduced via tubes, while iodinated contrasts are usually injected into the bloodstream for better absorption. The amount of iodine in the contrast affects image quality by blocking more X-ray photons. The bloodstream distributes the contrast to the intended area. It is metabolized in the liver and eliminated either through bile or by the kidneys via the urine. Since some contrast media can harm the kidneys, it is crucial to assess the patient's allergy history and kidney function status before administration. Drug interactions can either enhance or inhibit each other's effects, potentially leading to adverse outcomes. That's why it's important to get a detailed medication list of patients prior to administering any more drugs. For instance, combining ibuprofen with warfarin may increase the risk of stomach bleeding. Contrast media is primarily used in CT to better visualize suspected lesions or abnormalities that are not clearly seen on non-contrast images. It's important that the indications for the exam are listed to see if contrast is warranted for that study. The need for contrast is assessed by the ordering physician based on the examination requirements. Before administering contrast media, a thorough allergy history is essential to evaluate for any potential contraindications that an individual may have prior to receiving contrast. Each facility uses specific forms for this purpose. Common contraindications for IV contrast, such as iodine for CT or gadolinium for MRI, include history of adverse reactions to prior contrast media, asthma, allergies, heart disease, as well as kidney disease. For gadolinium-based contrast used in MRI, nephrogenic systemic fibrosis is a strict contraindication. For patients with diabetes, high blood pressure, or vascular disease, smoking history, or anybody over the age of 60, or with known kidney disease or a BMI of over 30, have potential to have an estimated glomerular filtration rate of GFR that will be higher. So the GFR must be evaluated prior to the injection of contrast media. Clinicians are the individuals who make the decisions to order what exam is appropriate for the patient. They must select the correct diagnostic test and contrast medium for the symptoms the patient is exhibiting, considering risks as well as contraindications. The American College of Radiology, or ACR, provides guidelines to help with these decisions, addressing various conditions and body areas. This is known as ACR appropriateness criteria for examinations. Before using contrast, the patient's condition should be assessed, which includes age, weight, lab results, as well as allergy history. For example, barium is unsuitable for suspected bowel perforation or ruptures due to complications, and a water-soluble high iodine contrast is preferred. In the event that the patient does have a perforation, the water-based solution is absorbed back into the body, and the patient will not have any complications. Age and weight influence contrast choice as well, with older patients often needing lower doses and obese patients requiring careful dose to avoid excessive contrast buildup in the fat. Factors for selecting contrast medium include compatibility with body fluids, so how well does it mix, viscosity, which is the thickness or flow resistance of the contrast, ionic strength, the concentration of the ions affecting the contrast behavior, persistence in the body, so how long will the contrast remain in the body, osmolality, which is the concentration of particles affecting fluid balance, iodine content, which is the amount of iodine used for image contrast, and lastly, toxicity potential, which is risk of harmful effects from the contrast. Patient preparation for contrast media varies depending on procedure. Lower GI examinations, patients must be NPO, so nothing to eat or drink, for 6 hours before the test and undergo a large bowel cleansing. Departments often provide specific instructions, cleansing solutions, as well as kits. Upper GI series require fasting for a few hours before the exam, but typically no additional special prep is needed aside from the fasting. For any contrast media examination, the technologist should explain the contrast administration process to the patient as well as possible side effects. The patient must be aware of potential adverse reactions and instructed to report them immediately. The radiographer must thoroughly review the patient's medical history, including allergies and past reactions to contrast media. Simply having the patient fill out a form is insufficient. The radiographer should ask detailed questions to identify any potential risks. Proper preparation involves more than just following procedural steps. It includes a comprehensive allergy assessment to avoid serious complications. Reactions to contrast media are the most common of lawsuits in imaging because the radiographer does not follow through. Some effects of contrast are immediate, and some may take hours, days, or even weeks to appear. A side effect is when an unintended effect is expected to occur and is essentially not harmful. An adverse reaction is an effect that can be life-threatening, such as anaphylaxis. Drug idiosyncrasy is an unexpected effect from a drug. For example, a drug given for sleep causes the patient to become hyperactive. Most commonly, what we see in imaging would either be a side effect or an adverse reaction. A side effect is something simple that a patient may exhibit during the reaction. For example, when a patient is injected with IV contrast, they may feel flushing or warmth. They may be nauseous or have vomiting. They may get a headache or some pain at the injection site, as well as altered taste. If the patient has a side effect, the patient should be observed, you should provide reassurance, and the infusion should be stopped. A vasovagal reaction is a little bit more severe. It is one that is due from the physiology of the body. It's not an allergic reaction, but a vasovagal reaction is a sudden drop in heart rate and blood pressure. It occurs due to an overreaction of the nervous system to stress as well as discomfort. This can happen when starting an IV on a patient. This condition is usually self-limiting and can be managed by having the patient lie down or elevate their legs to bring their blood pressure up. A patient having a vasovagal reaction will exhibit paleness, cold sweats, rapid pause. They may become faint or experience syncope, and they could pass out. They'll also have bradycardia as well as hypotension. If this happens, you want to stop the infusion, lay the patient flat or in the Trendelenburg position, notify a radiologist or nurse, and do not leave their side. Contrast reactions are broken down into 3 different categories: mild, moderate, and severe. Typically, patients will exhibit these types of reactions after getting IV contrast. Mild reactions are very similar to side effects almost. They're self-limiting, such as hives or a rash, and they generally require minimum intervention. Antihistamines might be used if symptoms persist. Symptoms of a mild reaction include nausea, cough, warmth, headache, dizziness, itching, pallor. You will also have to stop the infusion if a patient starts to experience reactions, and it's important to notify a physician or a nurse or a radiologist and prepare to help to administer oxygen and antihistamines if needed. Moderate reactions are more noticeable and may require medical attention. Symptoms include nausea, vomiting, urticaria or hives, mild bronchospasms, tachycardia, and mild hypotension. Treatment may involve antihistamines, inhalers, or elevating the legs. Severe reactions are rare but critical. These involve cardiac or respiratory arrest. Symptoms include severe anxiety, respiratory distress, and hypotension. Immediate CPR and advanced life support techniques are necessary. Technologists must be current in CPR training and have emergency equipment like a crash cart available during contrast procedures. I also like to note that some patients may start out with a mild reaction, just a little bit of a cough, maybe 1 or 2 hives, and it can escalate to a moderate or a severe contrast reaction very quickly. So a patient may not go into full anaphylactic reaction immediately. It may take 5, 6, 7 minutes, but they will have noticeable signs of a mild to moderate reaction starting first. So sometimes a mild or moderate reaction will just stay that way, but it can escalate and become severe. That's why it's important that patients are monitored before, during, and after contrast injections. All medications carry a potential risk. Radiographers must follow the 6 rights of a drug, which include the right patient, the right drug and documentation, the right dose, the right route, and the right time. Before getting a drug out of the storage cabinet or wherever it's stored, you're going to read the label and then read it again when you draw it up and read it a third time when you put it down and show it to the person who is injecting if it is not you. You want to make that person say the drug out loud to you so there is a verbal communication to verify that that is the correct drug that is being used. Do not use a drug if it is expired or if the label is smeared and not clearly readable, or if it looks like it's been tampered with. Also, if the drug has any type of sediment or is cloudy or just doesn't look correct, you don't want to use it. You want to make sure that the drug is stored correctly according to Joint Commission regulations. Document everything that you do with drug administration, what was given, when and how much, if the patient refuses, and any usual occurrences, even if you don't think it is a reaction. Before injection, ID the patient, explain the different side effects, and do an allergy history. Finally, do not discharge the patient until there has been some time that has passed after the injection in case the patient has a potential reaction. So there should be a wait period once you get the patient out of the exam room where they are monitored briefly. I always kind of try to just say, are you feeling okay? No itchiness or anything like that, just to verify that the patient is exactly feeling the same way they did before the procedure was started. Drugs can be administered through various different routes. Enteral routes include oral, sublingual, buccal, or rectal. Oral is written on a script as PO or by mouth. Sublingual is under the tongue and it will dissolve. Buccal is through the mucosal membranes in the cheek, and rectal is only used typically for nauseated patients who cannot retain oral drugs. Then you can inject through different tubes and catheters, which include a nasogastric tube, so an NG tube, or a nasoenteric tube, an NE tube, and then the drug goes to the stomach and the small bowel. Catheters into the rectum for an enema type introduction, or can be used for introduction into the urinary bladder. Inhalation through the mouth or the nose is possible so that the drug goes into the lungs of the patient. Topical administration means putting the drug on top of the skin or into the eyes or nose, not inhalation, but swabbing the nasal cavity and the throat like a gargle or lozenge. Vaginal applications may be different types of drug creams or foams, and the same would apply for anything that would be going into the rectum, such as like a hemorrhoid medication. Transdermal is a route where the drug is absorbed through the skin through a patch type application, like a nicotine patch or like a fentanyl patch. Lastly, we're going to discuss parenteral routes of administration. Parenteral routes of administration include subcutaneous, which is below the dermis. Absorption this way is typically slow. IM, which is intramuscular. So this can be done using any muscle, such as like the deltoid or the dorsogluteal, which are the most common. Intradermal, which is dermis or under the epidermis. This requires a long absorption rate. This is how they administer TB tests, so like the skin test for skin test PPDs. IV, which is intravenous. This is done typically through the median basilic vein or cephalic veins. First pass effect is bypassed, and it is immediate. Intrathecal, which is subarachnoid space between L3 and L4, so that's going into the spine. Smaller doses of any type of agent being injected into the spine are utilized. Intraarterial, this is being injected into the arteries. So some common arteries include the carotid, vertebral, or femoral. This is used when high concentration is needed. Intraosseous, this is done through the marrow of the bone. Most common place is to do this in the humerus, but it can be done in the femur or tibia, and it goes directly into the vascular system. Lastly, intraarticular. This is done through a joint space, and this is used for arthrography exams that are done in fluoro and sometimes in MRI as well. In conclusion, drug nomenclature is how drugs are named. Drugs are classified depending on their medical value or the risk of dependence and misuse. General pharmacology principles include the mechanism of the drug and the effect of it and the site of action. Pharmacokinetics looks at how drugs are absorbed, distributed, metabolized, and excreted. Contrast media are considered drugs because the majority have the same pharmacokinetics as other drugs. There are two different types of contrast classifications. Negative contrast, which is air and shows up radiolucent on X-rays, and positive contrast, which is radiopaque and show up bright on X-rays. Barium is inert and cannot be dissolved in solution. Not all patients are candidates to receive barium and may need to receive a water-soluble contrast instead orally. Both ionic and non-ionic contrast media can contain iodine. Both have a negative anion compound that provides a portion of the makeup of the contrast. The other part is a positive cation, which is either a sodium or megalamine compound that contributes to the osmolality of the contrast. The attenuation of the X-ray beam is affected by the atomic number of the contrast medium. The higher the atomic number, the more X-ray photons are absorbed and less hit the image receptor, thus creating more of a white appearance. Before injecting contrast media, it is important that all patients are screened for allergies and complete a pre-contrast questionnaire to evaluate for contraindications. Reactions can occur without warning, and also patients can have side effects to contrast medium. Adverse reactions can occur. and the ACR manual talks about its effects as well as responses. A vasovagal effect is physiologic and includes a paler appearance, rapid pulse, bradycardia, and hypotension. Contrast reactions can be classified as mild, moderate, or severe. A severe contrast reaction would be anaphylaxis and require immediate medical attention. Drug safety includes the 5 rights. Make sure you have the right patient, the right drug and documentation, the right amount, the right route, and the right time. It's important to read the label 3 times before administering contrast media to a patient. Drug administration is based on the pharmacodynamics of the contrast, and there are different routes of administration. The enteral route, tuber catheter, inhalation, topical, and parenteral routes, which include subcutaneous, IM, ID, intrathecal, intraarterial, intraosseous, intraarticular, and IV.